Many of the professionals don't understand, or many of the professionals get confused between the terminologies like reporting threshold, identification threshold, and qualification threshold for the impurities. So this video is made to make viewers understand regarding these thresholds and how the impurity limits are set considering these thresholds. The ICH guideline Q3A is for impurities, and in these guidelines the impurity specification requirements are provided for new drug substances and the drug products. The key thresholds are like reporting threshold, identification threshold, and qualification threshold. You can remember by putting it like initial R, initial I, initial Q, that is RIQ. R means reporting, I means identification, and Q means qualification. So these thresholds are the limits above which the impurities are required to be reported, impurities are required to be identified, and impurities are required to be qualified. First is R, it is reporting threshold. It is the minimum level at which the impurity must be quantified and reported in the impurity profile, and below this level it is not required to be reported. In other terminologies, it is called as disregard level. Purpose of the reporting threshold is to ensure that all the relevant impurities are monitored and disclosed during product development and regulatory submissions. So reporting threshold means it is the minimum level at which or above which the impurity is required to be considered, quantified, and reported. Key considerations for the reporting thresholds are analytical method sensitivity, risk-based approach, and it is based on the maximum daily dose, that is MDD. Analytical method sensitivity, that is quantification limit, must be below or equal to at least the reporting threshold. If reporting threshold is 0.05%, then the QL limit must be below that so that you can quantify it and report it. Risk-based approach, avoid setting thresholds too low or too high. That means if you set the limit as too low, it will increase the complexity, and if it is set too high, it will miss the risk of impurities. Based on the maximum daily dose of the product, the reporting thresholds are required to be set to ensure safety at highest possible patient exposure. So maximum daily dose is the dose of the drug product which will be consumed in the time of 24 hours. Then the identification threshold. Definition of the identification threshold is minimum level at which the impurity must be identified. That means structure elucidation is required to be performed, and below this identification level you can claim the impurity as unidentified impurity. Unidentified impurity may be specified impurity or unspecified. The specified and unspecified impurity are based on the RRT of the impurity. Purpose of the identification threshold is to ensure unknown impurities above this level are structurally characterized, helping to assess their safety and origin. For example, if the maximum daily dose of the product is 25 mg, the identification threshold will be 0.2%, and if the impurity is observed to be above 0.2%, then it is required to be structurally characterized. Also, we need to understand the stability condition for the higher impurity levels. If it is at some stress conditions or if it is at accelerated condition, then many of the times it is not required to be identified. But if the impurity is above the identification level at recommended storage temperature also, then it will be needed to identify and its structure required to be characterized. Key considerations for the identification thresholds are like unknown impurities that exceed the reporting threshold but remain below identification threshold can be reported as unknown. So as I mentioned, these are the unknown impurities till the limit is reached for the identification. If identification threshold is 0.2%, if you are getting the impurity as 0.15%, then you can claim it as unknown. If above the identification threshold, the structure elucidation is mandatory. It is also linked to MDD. Higher daily dose allows higher thresholds. So based on the maximum daily dose, you need to control the impurities and provide the identification thresholds. Generally, the dose of the API, as the API is formulated into a drug product, the maximum daily dose of the drug product is required to be considered. It will not be always like that. Higher daily dose will allow higher thresholds. But if you convert this into mg, then you can get some higher limits. But remember that always check the maximum daily dose of the specific drug product and then provide the identification limits. Third one is the qualification threshold. So definition of the qualification threshold is the level above which the impurity must be qualified. And qualification process, the impurity is identifying its safety through toxicological evaluations. So determination of the safety of the impurity is called as qualification. The purpose of this qualification threshold is to ensure that any impurity at a potentially harmful level is supported by non-clinical safety data. Key considerations: no qualification needed if impurity is below this threshold. If above, safety must be supported by the literature, clinical data, or new toxicological studies. Implications for known impurities. So qualification will be for the known impurities because identification threshold is lower than the qualification threshold, or sometimes it is equal to qualification threshold for some of the product with specific MDD. Based on MDD, the qualification threshold is calculated. So even if known, impurities must not exceed this limit without proper qualification. So if you know that the impurity is known, but still it is not like that, you can give the relaxed specification limits. So even if known impurities are there, these impurities must not exceed the limit without proper qualification. You can check here in the ICH guideline, impurities in the new drug substances. Thresholds are given. If the maximum daily dose is around 2 gram per day or above 2 gram per day, the reporting thresholds are there, identification thresholds are there, and qualification thresholds are there. If maximum daily dose is equal to or less than 2 gram per day, reporting threshold will be 0.05%, identification threshold will be 0.1%, 0.10%, or 1 mg as per the daily intake, whichever is lower. So lower limit is required to be given. Qualification threshold will be 0.15% or 1 mg per day intake, whichever is lower. So if your 1 mg is the lower, then identification and qualification threshold will be same. If the maximum daily dose is about 2 gram, you will get reporting threshold of 0.03%, identification threshold will be 0.05%, and qualification threshold will be 0.05%. Similarly, as per the ICH guidelines, thresholds are given for the impurities in new drug products depending on to the maximum daily dose. Thresholds are given for reporting threshold, identification threshold, and qualification threshold. I have made many videos on how to calculate the thresholds and how to give the specification. I request you to go through those videos. This video is for the understanding of reporting threshold, identification threshold, and qualification threshold. Thank you for watching the video.